We've been looking at PI for at least 5 years at different levels. We are a beef cattle state. It is the third largest ag commodity in the state behind only poultry and horses. Hard to believe that poultry is bigger than horses in Kentucky, but it indeed is. We have about 1 million mama cows. Herd is growing a little bit. We have 45,000 producers, give or take a few. And the average herd size is about 25 head. We're also a marketing crossroads, especially for the Southeast, but really from Indiana and some other states that border us, and there are 7 of those. We have a lot of backgrounders, and quite frankly, the backgrounders are the ones who are bringing this issue to the forefront in Kentucky. I was invited to a Kentucky Cattlemen's Association Board of Directors meeting about 2 years ago, and I'm going to introduce you to, it's not really a picture of the guy, but it kind of looked like him that day a little bit. And that was pretty much his comment was, "Doc, you got to do something." I'm real used to hearing that from animal welfare folks, but hadn't really heard it from him before that. So the answer to that, unfortunately, in many cases, is I can only do what the law provides. And he'd lost about $30,000 on a group of cattle that had at least a couple of PIs in them, and he was not happy. This law, KRS 257-040, I hadn't read a lot before we started talking about PIs, but it does apply. There's some key words in here, some key highlighted areas, but really the whole structure is very pertinent to the conversation. And Dan, I would almost guarantee you that if I took this bill to David, who's Dan's brother, is a senator in the state legislature, this bill would never get passed today. It probably was written for brucellosis and TB, and if you look down there below the amended part, which I don't think much was amended in 2009, this was written in 1942. And Carl, that was before you and I were born, I think. But it does give us as regulators the ability to do kind of what Tony was asking. And it says if you got an animal with a communicable disease, that's a reportable disease, these things you cannot do or you shall do. And the bottom down there says transport, sell, offer for sale, trade, or give away such an animal except on my permission. And we'll talk a little bit about what my permission might look like in certain cases. And our reportable reg, which is not very old, includes the OIE list, and BVD is on the OIE list. We get a lot of reports for BVD, and we don't investigate all of them, but we do get a report from all the labs, and we have 4 labs doing testing in Kentucky, and we do get regular reports from all of them. And Dr. Beth Johnson, who is here, follows up on those for me for the most part. And a little different conversation, we probably will go into that a little bit. But what can legally be done with a PI positive animal in Kentucky anyway? And you can remove it from a herd, and you have 4 options really to do that. You can send it directly to slaughter, and I hadn't heard the concerns about the meat, but it did come up in a conversation a little indirectly that we had at a meeting a couple of weeks ago. You can isolate it and feed it for slaughter. You can move it to permitted feedlot, of which I have none, but I would be glad to do it if somebody was so inclined to do it, or you euthanize it. What you cannot do is to send it to a stockyards or sell it. And the scenario I think that that Brian described or maybe it was Lindsay, of the animal moving through a market designated as a positive animal and then turning up again without the ID and without any discerning marks that say it's a PI can happen in Kentucky, has happened in Kentucky. We have investigated some. We haven't put anybody in jail yet, but I would gladly do it if I could catch a dealer doing that. So some of the guidelines that we have put out in response to BVD are there on the slide. we recognize that it does have a significant impact, not only on the health of our animals, but the marketability of our animals. And as I said earlier, all of our labs are reporting. For the most part, they're using the ELISA test, which I have great confidence in. Had a lot of discussion early on in this. Did we need to do a second test on all these animals? And we certainly will allow an animal to be tested again. I think that's probably a good idea. But I do think that there's probably close to 95% confidence that that one test recognizes that animal as a PI. So when we get a report, this is what happens. Dr. Johnson commonly will contact the owner or the attending veterinarian on the case and find out the current status of that animal, where it is it still alive. In most all cases, we find that the animal has been euthanized and buried. We use that as an opportunity to talk to the owner about PI, about BVD, and try to provide some education. We've already gone through the options that they have for that, so I won't repeat that. Only other to say that they cannot sell it or give it away. So I am appointed by the State Board of Agriculture in Kentucky. They decided at an August meeting to form a working group to discuss this issue. We've had 2 meetings. As you can see, the stakeholders on this panel are very diverse. We have somebody from Farm Bureau, from Kentucky Livestock Marketers, from Cattlemen's Association, from the Dairy Development Council, from our laboratories, from the board, and from veterinarians. And our task was to review Kentucky law and other states' programs and to develop recommendations for specific regulations and programs. Tony, to the regulation issue, even for Yonis, we do have a voluntary Yonis program in regulation, and it just outlines the parameters of it and what can be done. So things that we identified to consider were a certification program, a participation program, a little bit different thing, promotion to create market incentive. We have what's called a certified preconditioned health 45 program. Can we just add PI to that and sell that? Unfortunately, with like many incentive programs, our CPH program has gone from having somewhere in the neighborhood of 35 or 40,000 calves a year to now probably fewer than 5,000. It speaks a little bit to the really lack of market incentive for doing some things right. I think personally, and we don't have this at this time, we need official identification before tests are done. Commonly what happens now is the farmer is probably the only one that knows which calf is positive, and an ear tag with a 1, 2, 3, or 4 on it's real easy to take out. It would be good if we had a visual ID of positives, whether that's branding or another method, so that they are permanently identified in some way as to their status for PI. Some method to verify the test negative status of cattle as they go through a market. That could look like what we did for source verification for PVP programs to identify those animals at the market. And then the kind of granddaddy of the conversation has been indemnity for PI animals. So in looking at the Mississippi program, and not to downgrade certainly the Alabama program, which is where I learned most of what I know about PI, I did review Mississippi's program, and it seemed to fit a lot of the parameters. It's probably longer than I would want because they did a better job than I could probably do. But it has 4 basic elements: education, management, testing, and the enrollment process. And like anything, it has to be administered. We haven't really talked a lot about who's going to do what. A lot of it will fall in my office, but I think there are other things that the roles can be assumed by one of these groups. Certainly the diagnostic labs have a role. Cattlemen's Association, I think, is willing to participate, as is the Dairy Development Council. Extension's got to play a really large role, and I think we at least need to flesh out what the marketing association, the markets in Kentucky what their role would be in doing it. So just a little bit about a certification program and what it might look like. Our goal would be to attain and maintain BVD free or managed herd status. Is BVD free even a legitimate thing to look at? I questioned myself when I wrote that, but certainly it could be a goal. After hearing what happened in Germany, maybe it is attainable. Education and training so we understand what BVD is, address some risk management issues. There's obviously a publication out that Mississippi has made mandatory reading for their people in the program called Ethical Disposal of BVD PI Animals. And it needs to be included in a herd health management program, not just something that they can put in a desk drawer somewhere, but something that they're participating with their veterinarian and have an overall view of what good practices are and what biosecurity is. Identify what the test eligible animals are, both initially and on a yearly basis. I would think if we're going to enter them in this program, we're going to have a Prem ID on them. We're going to require official ID to be included on the accession form that goes to the lab. And some kind of an agreement program could certainly include a PVP type verification of when they will go to sell the animals. The participation program is probably at a lesser level where a farmer may just want to sell verifiable PI negative calves and not worry much about what is happening with these cows. Be easier to do, still need to have the Prem ID, still need to have official ID, some kind of enrollment agreement, maybe an affidavit to verify what has happened. He would have to test all calves. Additional screening would be voluntary, and he'd also be bound by the disposal agreement. So this is just a flow chart, same thing, some kind of a document that Mississippi did develop to give to the participants. Now to address indemnity just a little bit, and at our last meeting of the working group, Dr. Hessman from Kansas and Neil Odom both presented for us. In the next few slides that I'm going to show you, which are kind of a model of what indemnity could look like, was done by Mr. Odom, and I requested his permission to use this, and I modified things just a little bit, but pretty much what he showed to us was the first real opportunity that I had to see what the costs associated and the mechanics of a indemnity program might look like. From an income standpoint, one of the things that he suggested was a surcharge on mandatory testing at the markets. In other words, all the animals going through a market would be tested. A farmer would be charged a fee, and there'd be a certain amount of that rebated back to the indemnity fund to offset the costs of paying the indemnity. That particular lab has offered to rebate some of the testing fee that they charge within a state to support the program. Whether state checkoff money can be used or not, I don't know. We just recently in Kentucky added another $1 to the checkoff for state purposes. It's very, checkoffs by nature are very prescribed as to what they can be used for, and whether they can do that or not is something to be answered. Kentucky's been very fortunate to have their tobacco settlement funds dedicated to agriculture. They've been used in programs before. We actually have a poultry indemnity program in place now where the Poultry Federation, the 8 commercial companies came together and raised about $200,000. And then the Ag Development Board saw fit to match that with another $200,000. So we actually have $400,000 that the Poultry Federation can decide what they want to use in backyard poultry if there's an issue for indemnity. And we've used it on at least 3 occasions very successfully. It's a good model that maybe the beef industry would want to look at. So some of the mechanics that Neil suggested were putting a different value, if you will, on animals of different sizes to incentivize the farmer to look at that baby calf, to have it tested. So if you euthanize one under 225 pounds, you get 100% of the value as determined down there below that by the USDA market report. At over 225, you get 75%. Sell directly to slaughter, you get 50% of the value, and on and on. That last bullet there is kind of interesting, Dan, in that it was suggested maybe they be donated as a tax write-off to a food bank. And the folks there from KCA, after a little thought, didn't think that was probably a good idea. It probably wasn't the face we wanted to present to the public on this issue. So some of the numbers get kind of interesting. Actually, the number of cattle in this model fits Kentucky close enough that I think we could use it as a ballpark figure of what this might cost. If we have 1 million cows, we could assume maybe we have as many as 850 or 900,000 calves a year. At 65% participation rate, we'd be testing 600,000 according to this model. At a prevalence rate there of 5 in 1,000. Where it gets interesting is somebody else could probably tell me if that per pound price is in the ballpark, but it may be today. It might not be tomorrow. It wasn't a year and a half ago for sure. But we're seeing the estimated value there of PIs at about $3 million. Well, that was based on different percentage of indemnity based on this value. So the value of those PIs would be $3 million. And if you go to the next slide, then you've got it broken out by those different classes to where, by his estimate, we could be looking at probably from $1.25 million to $1.5 million be necessary to fund this program. So I don't know if that is at all doable. I do know some of the funding streams might not be sustainable, might not be possible, period. Some of the things that Lindsay talked about as far as the mechanics of the market and doing mandatory testing of all the animals, let's just take all the animals out of it. Let's just say beef feeder cattle. The logistics of doing that at the markets in any kind of a market speed of commerce fashion is not probably very doable. That's been the big discussion about ADT or NAIS before that, is could we address that class of cattle logistically in the markets today? And I'm not saying we can't, but I'm saying we'd have to change some things we're doing, and I'm not sure that we can. So.